Hi guys, Dr. Cliff here with HearingLoss.com, and in this video, I'm talking about why so many hearing care providers do not follow best practices. Experts estimate that only between 10 and 30% of hearing aid clinics follow best practices. What are best practices, you may ask? Great question. I've covered this topic in greater detail in a separate video that I will link down in the description. However, they are essentially a series of research-proven procedures that must be completed in order for you to receive the maximum amount of benefit from your hearing aids. And if any of them are not completed, there is a high probability that you are not going to hear your best. So why do so few clinics actually follow these best practice procedures if they are the only way to maximize your benefit with hearing aids? Well, that's where things get a little confusing. You see, the first reason is your hearing care professional may not be aware of what these best practices are or how to perform them. This really depends on the level of training and education they received in order to obtain their state license. Not all providers have the proper education when it comes to best practices, which is unfortunate but true. The second reason is that some hearing care professionals may not have the proper equipment to facilitate best practice care. Audiologic equipment is expensive, and in order to perform certain best practice procedures, the minimum equipment requirements are having an audiometer, hearing instrument test box, and probe microphone equipment to perform real ear measurement. If the clinic that your hearing care professional works for does not provide this equipment, essentially your provider's hands are tied, meaning you're not going to get these best practices regardless of whether or not they want to provide them for you. The third reason is that most individuals with hearing loss will still spend thousands of dollars on hearing aids despite the fact that their provider doesn't follow best practices. Let's face it, you are the best advocate for yourself when it comes to receiving high-quality audiologic care. If you do not hold your hearing care professional accountable to a higher standard, then who will? And the longer you're willing to go to your hearing care professional who does not follow best practices, the more likely they're not going to provide them for you in the future. The provision of best practice audiologic care is completely voluntary. It is not required, which means that even if your hearing care professional decides to cut corners, there is no governing body that will hold them accountable. So now that you know the 3 reasons why most hearing care professionals do not follow best practices, what can you do about it? Well, the answer is simple. Educating yourself on what these best practices are and either demanding that your provider follows them or find a different hearing care professional who will. Your ability to hear is too important to be leaving a significant amount of hearing aid benefit on the table. But until more clinics offer these critical best practice procedures, you need to take matters into your own hands and demand that they follow best practices immediately. Alright guys, I hope you enjoyed this video. If you did, please hit that like button and make sure that you subscribe to the HearingLoss.com YouTube channel for more informational content. I'll see you in the next video.